Yeah, trendsetter, whoa, league of my own, it don't get better. No, read what I wrote, I'm a bestseller. Yeah, reach for my goals, hit it dead center, hit it dead center. Bullseye, hit it the most, is no misses. Something like fish in a barrel, it's no different. Blindfold on me, I still got the most vision. Trendsetter, total.
And in canine Pemphigus foliaceus, the immune system produces immunoglobulin G autoantibodies, and against these desmosomal proteins, mainly desmocolin and desmoglin 1, when these antibodies bind to the desmosomal proteins, they disrupt the connection between the two keratinocytes. So they disrupt the connection between them, and as a result, the skin. So in nasal planum, we may observe the loss of the normal cobblestone appearance of the nose. And coming to the ear pinna, the inner and outer surfaces of both the ears we can diagnose it is not because of the parasitic, it is because of the autoimmune disease condition. And coming to the foot pads, these foot pads in some dogs, it may thicken, crusted and cracked and hyperkeratosis kind of the lesions we are noticing. And because of these cracks and painful nature of this foot pad, it may result in the lameness or reluctance to walk. And as the disease progresses, the lesions may spread to the trunk and limbs, and they may lead to the generalized crusting and scaling and patchy alopecia. And apart from this, the lesions usually start on the face and ears and then spread to the foot pads, trunk. Apart from that, we are also noticing that the systemic clinical signs, like because of the antigen antibody immune reactions will be taken place, there is inflammatory changes will be noticed. So the rise in the temperature, and the animal show the depression, lethargy, and sometimes the weight loss is also a prominent clinical sign in autoimmune disease conditions, especially in Pemphigus foliaceus. And one more important thing is just like in hormonal dermatosis, for example, in hypothyroidism and adrenocorticism, we are noticing the bilateral and symmetrical kind of the clinical alopecia. So such kind of the lesions, clinical signs, we are also observed in the Pemphigus foliaceus. So all these conditions, they mimic one from another. So the diagnosis plays very much important role in the Pemphigus foliaceus. So because the lesions, they are distributed equally on both the sides of the body and making bilaterally symmetrical involvement, and the lesions, the common sites and the most common lesions, they may be present in every disease, dermatological disease conditions. So we have to, the diagnosis plays very much important role here. And this is the picture showing the what are the various clinical signs with the percentages. So the pustule is the first primary clinical sign, even though because of early eruption or early rupture of that pustules, we are noticing the crusting type of the clinical signs are more common in Pemphigus foliaceus, followed by the erythema, alopecia, pustules, scales, erosions, pruritus, and hyperpigmentation. So this is also mimicking that malassezia infection. And the lesions are also very much common on the trunk area and inguinal areas. And lichenification and secondary pyoderma and onychogryphosis, they are very common. And based on this, we are telling the key points like the crusting is the most consistent clinical sign in Canine Pemphigus foliaceus, and it is followed by the erythema, alopecia, and pustules. And the lesions are typically non-pruritic to mildly pruritic. It is not very much itching is not observed in case of the animals. So it is non-pruritic in initial stages. Later, if this Canine Pemphigus foliaceus, it may be associated with any secondary infection. In such conditions, you may notice that the pruritic kind of the lesions. And secondary bacterial infection, it is very common in case of the Canine Pemphigus foliaceus. And the typical distribution is also plays important role in diagnosis of the Canine Pemphigus foliaceus. And these are the various canines presented to our clinics with the history of crusty lesions, erythema, and vesicular lesions and pododermatitis. We ruled out that based on the every diagnostic aspects like skin scraping examination and dermatophytosis ruling out, and after that the antimicrobial sensitivity test and cultural examination, everything after ruling out, we confirmed it as a autoimmune disease, that is Pemphigus foliaceus, based on the histopathology and cell cytology. So these pictures indicating that the crusty lesions, in first pic, it is a 3 months old dog, and it is showing that crusty lesions on all over the body. It indicating that it just mimicking the sarcoptic kind of the lesions, but on diagnosis, we confirmed it as a Pemphigus foliaceus. Here also, this dog presented to us. The dog came to us for the vaccination. So after the vaccination, immediately after 30 minutes, it developed anaphylactic reaction. So we given that histamine and dexamethasone, but the clinical signs are not decreased. And again and again relapsing, we are observed. And after that, the sample was taken and done the histopathological examination. Then we confirmed it as a Pemphigus foliaceus. And other pictures, these are the symmetrical distribution of the lesions, we are cannot differentiate them from the hypothyroidism. So these symptoms are very mimicking the hormonal kind of the dermatosis. And this simple crusty lesion on the elbow region, this is also very common in case of the parasitic mite infestation. It also not we are giving the ivermectin and everything, but there is no improvement was observed. And after that, the owner wants everything for the diagnosis. So we went for the biopsy and histopathological examination, and then we confirmed it as an autoimmune disease. And after that, therapy given, and after that, there is a lot of improvement was observed in these dogs. And this is also a lumbosacral region. This kind of the clinical signs are very common in case of the flea allergic dermatitis. Because of flea allergic dermatitis, we may observe erythematous lesions on the lumbosacral area, but it is showing that epidermal colorates and ulcerative kind of the lesions on the lumbosacral region. So we are giving the treatment, but there is no improvement. And after the diagnosis, we given that azathioprine, and a lot of improvement was observed. And pododermatitis, this is foot pad. It is also very common in case of the demodicosis conditions, but because of the autoimmune disease, the clinical signs like erythematous lesions and vesicle formation are noticed on the foot pad. And these are the other clinical conditions we are observed. And so these are other pictures. They are also on the ear pinna, the crusting lesions we are observing. All these clinical signs we are observing during every day in different disease, dermatitis disease conditions. But we are not knowing that it may be because of the autoimmune disease conditions. So the thorough diagnosis is very much important to rule out that autoimmune disease condition. and this vesicle formation, and this is reoccurring like again and again, and we are done the histopathological examination, and after that we ruled out that it is because of the Pemphigus foliaceus. So it is diagnosis of Pemphigus foliaceus is it is very easy. So the dogs presented with all the clinical signs like pustules, crust, and erosions, ulcers, alopecia. So first we have to take that entire history, complete history, like which breed and age, what is the age, any drug history previously treated or not, any vaccination history immediately after vaccination. The dogs developed such kind of the clinical signs, and any previous treatments, the previous history, and any seasonal and non-seasonal or any food type of the allergens. After giving any kind of the food, we have to take the food history also, and systemic illness like any increase in the temperature or weight loss or the owner is observing or not. And after the complete history and after the thorough clinical examination, like distribution of the lesions where they are located, like on the face, nasal planum or periocular areas, foot pads, trunk, limbs, and folds. All these kind of the clinical signs, like whenever we see a dog with recurrent pustules, thick crust, facial lesions, and poor response to the antibiotics, we should suspect it may be because of the Pemphigus foliaceus. So the history and dermatological examination, we have to collect a detailed history and perform a thorough dermatological examination, and we note the duration of the disease, previous treatments, and lesion distribution, and whether the lesions are bilateral and symmetrical, and rule out the infectious diseases before confirming the Pemphigus. And why? Because this superficial pyoderma, it is mimicking like autoimmune disease, that is Pemphigus foliaceus. So it is very important to rule out common infectious skin diseases. And apart from that, skin scraping examination to rule out the parasites like dermaticosis, especially the dermaticosis, and fungal culture to rule out the dermatophytosis, and rule out the dermatophytosis, and we perform fungal culture to rule out any trichophyton, or bacterial cytology to identify the superficial pyoderma. So apart from these, all these steps are very much important because the disease can produce lesions similar to the Pemphigus foliaceus. And after that cultural examination, all these are negative for above skin scraping and the cultural examination, everything. Then we go for the cytological examination. So on bacterial cytology, it may identify that superficial pyoderma. So this step is important because these diseases can produce lesions similar to the Pemphigus foliaceus. And the next step is cytology from an intact pustule. So we have to take the intact pustules and we have to go for the cytological examination, and like difficult method by using that, or so the characteristic finding is the presence of the acantholytic keratinocytes on the microscopic examination, along with non-degenerative neutrophils we may observe. And after that, this is not a confirmatory test, it is only the clue for the Pemphigus foliaceus. This cytology is telling that only the acantholytic keratinocytes are present in the cytology. So it indicating that any Pemphigus complex related diseases or any immune mediated disease conditions. And so this is a only rapid clue. It is not confirmatory. And after that cytology revealing acantholytic keratinocytes, then we go for the histopathological examination by taking the skin biopsy. So this skin biopsy sample should be collected from the fresh intact pustules or early lesions for the histopathological examination. This is a gold standard histopathology test. And so this is for the diagnosis, confirmatory diagnosis. And it may reveal that the typical findings of the subcorneal pustules, they may containing the acantholytic keratinocytes and along with that inflammatory cells. So it indicating that it is positive for the Pemphigus foliaceus. Apart from that biopsy, histopathological examination, and cytology, other immunological tests are also available, like immunofluorescence test and direct and indirect immunofluorescence test. For the direct immunofluorescence test, we are taking the biopsy sample, and for the indirect fluorescence test, we are taking the serum sample, and we are diagnosing whether the animal is suffering with the Pemphigus foliaceus or not. And apart from that, many immunological diagnostic tests are available too for the research purpose. It is not easily available at clinics. For the research purpose, many laboratory diagnostic tests are available, but they are very much costly. And coming to the punch biopsy, this is very much important for the confirmation of the histopathological diagnosis. So how to take the punch biopsy, and what are the various measures we have to take while during the biopsy sample collection. This is very much important. Here, two types of the punch biopsy are available. So full thickness punch biopsy, it includes the epidermis, dermis, and subcutaneous tissue. And a deep punch biopsy is also there. So it includes only the epidermis and dermis. So for Pemphigus foliaceus, the lesions are present in the epidermis. So this deep punch biopsy is enough for the histopathological examination. And the sample procedure, it is very much important here. So it requires a simple procedure used to obtain a full thickness skin sample. It helps us confirm the diagnosis by examining the microscopic changes in the skin. And choosing the biopsy site is also very much important. So the biopsy should always be collected from a fresh and intact pustule or an early lesion, because these contain the characteristic histopathological changes. So old crusty lesions, old pustules we are taking, it gives the false negative result. So the fresh sample is very much important for the diagnosis of the Pemphigus foliaceus. And the ulcers, old crust, and chronic lesions, they may not be useful for the diagnosis purpose. And all of you know the biopsy procedure, I think. Mostly during the biopsy, some dogs are very cooperative. In such conditions, we may use the lignocaine gel on the affected area after proper scrubbing and everything. In some ferocious or aggressive canines, or we can give the local anesthesia by using the gelazine, and clip the hair carefully without scrubbing or damaging the lesion, and clean the surrounding skin gently with the saline if required, and use a minimum of 6 to 8 punch biopsy instrument to collect a full thickness skin sample, and take multiple biopsy samples from the different fresh lesions to increase the diagnostic yield. So this is very much important. So small sample, this may not useful. So we have to go with the full thickness sample, and the samples also, the size of the sample is also very much important. So in small dogs or small breed dogs, only 2 sample is enough for the diagnosis of the histopathology. If it is a small to medium sized dogs, we need 3 to 4 sample, and large dogs like German Shepherd, Labradors, we may require the thick skin. Because of the thick skin, we may require the deep lesions. So 6 sample is used, and in case of the very large lesions are present, that pustules and the vesicular lesion is very large in size. So in such conditions, we may go for the 8 thickness of the spool. Along with the vesicle, we can take the sample and we can rule out, we can put in 10% formalin immediately, and after that we can send it for the histopathological examination. And these are the various pictures. The dog suffered with the Pemphigus foliaceus after histopathological cell cytology. It indicating this kind of the keratinocytes, large round keratinocytes. It is a characteristic feature of the Pemphigus foliaceus in Pemphigus foliaceus. And coming to the histopathological examination, it is a gold standard diagnostic test. So in this, we are noticing the subcorneal pustules, Mostly it is associated with the neutrophilic infiltration and dyskeratosis and minimal dermal inflammation we are observing. So the biopsy should be collected from a fresh pustule or early lesion, it indicating that it gives a good accurate results. And this is another test that is immunofluorescence test. So if the test is positive for the purpose of research, we see the characteristic intercellular fluorescence pattern. This is called as the fishnet or chicken wire pattern. And this pattern indicates that the immunoglobulin G autoantibodies are deposited around the keratinocytes, and which is a characteristic finding in case of the Pemphigus foliaceus. And coming to the indirect immunofluorescence test, we required the canine serum, and ELISA is also useful for the useful laboratory test to detect the Pemphigus foliaceus. So in ELISA we can detect specific autoantibodies, particularly against this desmoglein and desmocolin proteins. And mostly this ELISA, immunofluorescence, and other new diagnostic techniques, they are used for the research purpose and for the confirmatory diagnosis purpose and for the accurate treatment. And these new diagnostic techniques are also available like immunoblotting, immunoprecipitation test, and confocal microscopy, autoantibody profiling. Like mostly these antibody profiling, they are useful for the detection of the desmocolin 1, desmoglein, and how much they are affected in disrupting the keratinocyte binding. And so mostly the current research focusing on this autoantibody profiling, so that the treatment also given according to that. And the cytokine profiling, and mostly we know that interleukins and interferon necrosis factors, all these factors, they are the potential biomarkers for the disease activity. So better monitoring and more targeted
Doctor, you have been muted. Hello.
Now it is okay, madam?
Yeah, it's okay. It's okay.
Okay. So now coming to the previous slide, are you audible?
Yeah.
Okay. So differential diagnosis, coming to the differential diagnosis, just all the infections, whatever presented here, like foliaceous and superficial pyoderma, dermatophytosis, dermaticosis, and discoid lupus erythematosis, bullous pemphigoid, all these containing the similar kind of the clinical signs, like they mimic erythema, pustules, crusty lesions, everything. But coming to the cytological examination, we may differentiate that only the Pemphigus foliaceus, it is having the acantholytic cells, and superficial pyoderma is also having the acantholytic cells, but it is it is having degenerative neutrophils. But in case of the Pemphigus foliaceus, we are having that neutrophilic infiltration. And on histopathological examination, the subcorneal pustules are very much present. And compared to the other disease conditions, this is only the diagnostic test for the confirmation of the Pemphigus foliaceus. Slide not moving, sir. Now coming to the treatment. So this is very much important part to achieve these goals. Treatment can be divided into three main categories. So the first one is the immunosuppressive therapy and adjunctive therapy and supportive care. So everyone knows for every autoimmune disease conditions, the corticosteroids like immunosuppressive therapy is the cornerstone of the treatment. And mostly the corticosteroids like glucocorticoids and prednisolone and glucoprednisolone, they are used initially, and steroid sparing agents. If the glucocorticoids not functioning well in such conditions, we go for the steroid sparing agents like azathioprine, cyclosporine, or mycophenolate mofetil. They may be added to maintain the long-term disease control and while reducing the steroid related side effects. And coming to the adjunctive therapy, mostly along with the immunosuppressive therapy, we go with the adjunctive therapy like If the animal is suffering with any secondary bacterial infections, in such conditions, we may include antibiotics, like mostly the tetracyclines, and for secondary, other like niacinamide, and topical antiseptics, omega fatty acids, vitamin E may contain antioxidant and other medications. They may improve the skin health and they may reduce the inflammation. And supportive care, coming to the supportive care, mostly it includes gentle skin cleansing by using the good medicated shampoos, good nutrition and pain management when needed, and regular monitoring of the hematobiochemical parameters were very much important. So in all the autoimmune disease conditions, we have to monitor the hematobiochemical parameters for every 3 months, once in 3 months, to rule out whether the liver and kidney status. And now coming to the corticosteroid therapy, the first line of therapy, that is most commonly used drug, prednisolone. So initially we can give this the induction dose. It is 2 to 4 mg per kg body weight per day orally. Sometimes the dose may changes, like if in case of the severe conditions, if the ulcerative kind of the lesions we are noticing, and after giving prednisolone for 10 to 14 days also, there is no improvement in clinical conditions. In such conditions, we may increase the dose up to 6 to 8 mg per kg body weight orally. And if it is not showing any clinical signs, then we go for the intravenous injections of the corticosteroids like dexamethasone also. And the dose is 1 to 2 mg per kg body weight for 5 to 7 days. And after that, we go with the oral therapy, that is twice daily for 10 to 20 days. And after that, we can decrease the dose for up to 0.5 to 1 mg per kg body weight. So the aim is to quickly suppress the abnormal immune response. That is why we are increasing the dose, and we are not stopping at the immediately. Okay, we are not stopping immediately. We are gradually tapering over weeks to months, so that it stops new skin lesions from formation. And once the dog shows clinical improvement, such as healing of pustules and crust with no new lesions, the dose should not stop suddenly. So this is very much important. Most of us, we are doing that immediately after stopping of the clinical signs, everything was normal, and the hair growth we are noticing. In such conditions, we tell the owners that stop the treatment, but it is not advisable. So we have to don't stop the treatment suddenly. So instead, it is gradually reduce the dose over several weeks or months and to the lowest effective dose. And this helps to prevent disease relapse while minimizing side effects. And during corticosteroid therapy, we are also regular monitoring of the hematobiochemical test is very much important, because they are having many side effects like polyuria, polydipsia, weight gain, and liver changes. And so we have, and for the liver test, we go for the GGT, so that the normal values may rise in case of any side effects we are observing. So this is very much important during the corticosteroid therapy. But for any case, the corticosteroid therapy is the cornerstone of the therapy. So start with the corticosteroid therapy in autoimmune disease conditions initially. If there is no improvement in such conditions, only you can go with other other medications like steroid sparing immunomodulators. So however, some dogs they may not respond adequately, and they may relapse, show the relapse when the steroid dose is reduced sometimes. So, or it may develop serious side effects such as excessive thirst, urination, muscle twitchings, muscle wasting, or increased risk of the infections. So in such conditions, we can add along with the steroids, or sometimes we can give the tapering dose. Along with the tapering dose, we can use the other steroid sparing immunomodulators like azathioprine. It is given at the rate of 1 to 2 mg per kg body weight. And still it maintains the disease control, and this minimizes the steroid related adverse effects like polyuria, polydipsia, and liver related changes. And it is effective but requires the regular monitoring, and because it can affect the bone marrow and liver, and sometimes we may also observe that the cystitis and gastrointestinal upset, mostly when we are using the steroids, we are noticing the clinical signs like gastrointestinal upsets, or sometimes the hemorrhagic enteritis. So in such conditions, before you are using the steroids, please go with the GI protectants like pantoprazole and everything, and along with that you give the uh, prednisolone. And now coming to the cyclosporins, all of you know the cyclosporins are also very effectively selectively, it may suppress the T lymphocyte activity, and it is also a good immunomodulator, and which is particularly useful in case of the canines. It cannot tolerate when conditions like the corticosteroids and azathioprine is not working very well in case of the autoimmune disease conditions. In such conditions, you go with the cyclosporins, and so this is also having the side effects like the cystitis conditions. So just check with the KFT levels regularly, and the urine color change. You ask the owner to check the coloration of the urine. So if anything is abnormal, then immediately stop the cyclosporin. And now coming to the mycophenolate mofetil, this is also very much another effective immunosuppressive drug. With a relatively rapid onset of the action, the most common side effect here is also the gastrointestinal upset. And coming to the chlorambucil, this is also rarely used drug, mostly selected for severe conditions only. The dose is 0.1 to 0.2 mg per kg body weight. And now coming to the emerging or rescue therapies, so all of you know that oclosutinib, it is also working very well. We use it in 2 to 3 canines. So 2 dogs were showed very much improvement in case of the autoimmune diseases. The dose is 0.4 to 0.6 mg per kg body weight per oral, and so most of the case reports are also available regarding this oclosutinib. And coming to the intravenous immunoglobulins, nowadays it is very useful in case of the severe condition, severe autoimmune disease conditions are observing canines. Apart from all these drugs, there is no improvement was observed. In such conditions, you go for the intravenous immunoglobulins. They are available in humans. We use it for one dog. It given the improvement within 10 to 14 days. So the dose is 1 to 1.5 grams per kg body weight. The cost of this drug is very high, that is 4,000. And therapeutic plasma exchange and other immunomodulators like tacrolimus for topical applications for the tacrolimus. It also works very well in controlling the pustular lesions and erythematous lesions. So all these treatment, the first primary treatment is mostly the corticosteroids, and compared to the, if the corticosteroids are not working very well in such conditions only, you can go for the steroid sparing immunomodulators, but we cannot stop the corticosteroids immediately. So we have to give tapering doses. Along with that, azathioprine we have to give. And along with azathioprine, if any secondary infections are very high in such conditions, the doxycycline gives very good result, and niacinamide also plays a very good result in case of the Pemphigus foliaceus. And coming to the topical and supportive therapy, this is also very much important. Antiseptic shampoos such as the chlorhexidine and benzoyl peroxide, it helps in removing of the crust and reduce the bacterial concentration on the skin and keep the lesions clean. And if the dog develops a secondary bacterial infection, these antibiotics should be given, and these should always be selected based on the culture and sensitivity testing to ensure the most effective treatment. And omega fatty acids, they may help in the reduction of the inflammation and support the healthy skin and coat. And with E, it is everyone knows that it plays very much important role as an antioxidant, and it promotes the skin healing. And we also go with the vitamin A injections. They may play very much important role in regeneration of the epithelial skin layer. So it also works very well. And in severe cases, the sunlight exposure should be restricted because these UV light flare up the skin lesions. And coming to the monitoring response, so clinical monitoring mostly on day 7, day 14, and day 30, we can monitor the clinical signs. And so in this, there is reduction in the pustular lesions and decrease in the crust formation, hair regrowth, improved comfort. Then we can taper the dose and we can continue up to 3 to 6 months. And later again, we can go for the biopsy and we can check whether the acantholytic cells are present or not. And if the acantholytic cells are not present in such conditions, we can stop the treatment and we can give the antioxidants and omega fatty acids, continue up to 6 months. And laboratory monitoring is also very much important in case of the autoimmune diseases. Why? Because because of giving all these azathioprine and mofetil, everything, they may causes the KFT changes and liver LFT changes. Because they may having the adverse effects on the urinary system and hepatobiliary system. Sometimes the other adverse effects like mostly the pancreatitis, the development of the pancreatitis is also very commonly observed in case of the autoimmune diseases. They are treated with the corticosteroids. So this pancreatic profile is also very much important. We go with the pancreatic profile and any abnormal changes will be there in such conditions. Go with the pancreatic drugs. And in CBP also, we are noticing only the increase in the neutrophilic concentration only. Other parameters were very normal. And coming to the prognosis, this prognosis is variable, which means it differs from one dog to the other based on their immune response and immune tolerance. And some dogs, they may respond well to the treatment, and while others, they may require more intensive and long-term management, lifelong therapy. And mostly the factors affecting prognosis like severity, treatment response, and secondary infections. If the severity of the disease is mild, in such conditions, the better prognosis we may see. And then with the severe conditions and response to treatment, mostly the dogs that respond quickly to immunosuppressive therapy generally have a more favorable outcome compared to the severe conditions. And if the dogs they don't respond to any other treatment. And secondary infections, if bacterial skin infections develop, they can delay healing and worsen the prognosis. And early detection and treatment of these infections improve the recovery chances very high compared to the late diagnosis of the disease conditions. And coming to the recent advances, mostly most of the scientists, they are doing research work on the targeted immunomodulation and cytokine pathway research and better understanding of the autoantigens and personalized immunosuppressive protocols. So all these things, they may play important role in the immediate treatment and prompt treatment of the disease condition. So these targeted immunomodulations, they may suppress the entire immune system using drugs such as corticosteroids and other immunosuppressants. So these newer approaches, they may aim to selectively target the abnormal immune response while preserving normal immune response, normal immune function. And this targeted immunomodulation, they may improve treatment efficacy and reduce the adverse effects such as infection and metabolic complications. And these cytokine pathway research, mostly the researchers, they are also studying the role of the cytokines and which are the chemical messengers. They may regulate inflammation and understanding the cytokine pathways such as interleukins and tumor necrosis factor, and they may lead to the development of the biological therapies that significantly block the inflammatory signals, and they may be responsible for the autoimmune skin disease. And these autoantigens, most recent studies are improving our knowledge of the specific autoantigens involved in the Pemphigus foliaceus, particularly desmosomal proteins. They may be responsible for cell-to-cell adhesion in the epidermis. And identifying these targets, they may enhance our understanding of the disease mechanisms and they may enable earlier diagnosis and more specific therapeutic interventions. And coming to the personalized immunosuppressive protocols, it is also exciting concept. And instead of using the same treatment protocol for every patient, therapy can be tailored according to the disease severity and the breed predisposition and response to the treatment and concurrent illness and individual drug tolerance. So all these are recent advances. So these are the generic name and trade names available. So mostly the human drugs we are using for the canines, they are giving very good result. And other immunomodulatory therapies like intravenous immunoglobulins, the mechanism behind this is the neutralizing autoantibodies and immunomodulatory. So we have to give 1 to 1.5 gram per kg, and we have to give 3 to 4 weeks, and after that we have to stop these intravenous immunoglobulins, and later we can go for the histopathological examination. But the chances of the relapse is very less in case of the intravenous immunoglobulins. And the plasma exchange also nowadays commonly used at various places, but we are not given this therapy. And oclosetinib, rituximab, oclosetinib also giving good result. The case reports are present. And rituximab we are not used, so we don't know regarding the improvement and everything. So these are the various immunomodulatory therapies. So before I conclude, I would like to summarize the key messages from the today's presentation. So the first, canine pemphigus foliaceus is the most common autoimmune dermatosis or skin disease in dogs, and making it one of the most important autoimmune dermatosis encountered in clinical practice. And second, the hallmark pathological feature is the acantholysis, and which means the keratinocytes lose their adhesion to each other and resulting in superficial pustular formation. And cytology, it gives only the clue regarding the disease condition. And histopathology, it is a gold standard test. And immunosuppression, it is a cornerstone therapy. And long-term monitoring is essential in case of the autoimmune disease conditions. And the owner education also plays very much important role. Why? Because most of the owners, they will tell every time how much time it takes to improvement. So owner education also plays very much important role in case of the autoimmune skin disease conditions. So thank you. With this, I conclude my presentation. Thank you all for your kind attention, and I thank PV Narasimha Rao Telangana Veterinary University and College of Veterinary Science and Indian Association of Veterinary Dermatology and Drools for giving me this opportunity. And I also thank Dr. Purushottam and Dr. Akshit for helping in making the presentation. Thank you.
Thank you, Dr. Revati. Jyothi.
Jyothi.
It's a very nice presentation you have given. And there are certain questions. Before that, I just wanted to tell, recently, oclosetinib was found to be effective in treating the Pemphigus foliaceus, the dose rate of 0.6 mg per kg body weight. There is BID.
Yes, sir.
So they have, there are certain reports in this thing. And also there is a pentoxifylline that also being used in this. There is 30 mg per kg body weight. Higher dose has to be used instead of 10 mg per kg body weight. 30 mg per kg body weight has to be used. And then only you can have some result in it. Apart from that, we have got a recent drug called rituximab. That is a monoclonal antibody. She has shown in their slide. In human, they have been using it successfully. That is 375 mg per meter square they are using. And sometime with the immunoglobulin also, a combination with the immunoglobulin they are using and having a success. But off-label use of this rituximab has been used in dogs. And still work is going on to find out weekly intervals for 4 weeks. They have done a very good work, and it has got a very good report given by some authors. But still a lot of work has to be done in it. And then we have been using this azothioprine very commonly and cyclosporin very commonly along with the prednisolone, or sometime individually tapering the prednisolone and going for azothioprine like that, depending upon the individual response we are doing. And recent this monoclonal antibody, that is rituximab, is highly effective in human, and they started working on it in dogs. We will see. We'll wait and see how it is working clinically. Now it is only off-label. Maybe in future we'll be having some good drugs like rituximab. We'll be having with that. They can. There are certain questions I think you can answer for it in the chat box. Drools team, can you help?
Yes. Thank you, Dr. Jyothi, for the insightful and informative session. And thank you, Dr. Nagarajan, for the informations. And so now we'll begin our interactive section, interactive question and answer section. So there are a few questions. First one is, Dr. Nagarajan has already explained about pentoxifylline. So I'll move on to the next question. Can we use glucocorticoids in secondary intermediate hemolytic anemia in case of Babesia? In my case, liver value is elevated. So in this situation, can I use prednisolone to suppress the immune system?
Yes, we can.
Okay, thank you, doctor. The next question. How to differentially diagnose this case from atopic dermatitis?
So coming to the atopic dermatitis, mostly the skin lesions, they may seen like erythematous lesions on the periocular area and commissure region and ear pinna, ventral abdomen and interdistal spaces. And for the atopic dermatitis, we are having the intradermal allergic skin test. So in that test, we can confirm whether the canine is suffering with the canine atopic dermatitis or not. Apart from that, IgE test is also, allergen test is also available.
So actually, this test, that intradermal test is not for diagnosis, but it is for taking the allergen for immunotherapy.
Rule out the allergen.
So actually, you have to rule out the infectious causes and other causes like microbes and parasites, along with other like cystic ovary and other thing. After ruling out with the ultrasound and other thing, we can go in for applying the favorite error criteria. If it is going to work out more criteria, and if the lesion by identification only by deletion of ruling out one by one. So we have to check the symptom and how it is progressive in that. Later we have to confirm it, and seeing the response, the steroid and other immunosuppressive drugs will be in a position to identify the disease. And then we can go for other allergen test or anything if it is needed, and if it is available for India, then we can go for it and then go for immunotherapy. That is the thing. But here, in case of Pemphigus, a very simple test, as the doctor was telling, we can very well go for seeing cytology. That cytology itself, we can identify with the non-degenerative neutrophils. That is the very important thing. If it is going to be a pyoderma, because in pyoderma also, if it is going to be a severe pyoderma, you can expect to have the acantholytic cells, but the acantholytic cells will have degenerative, as doctor was telling. And so pyoderma cases, there will be degenerative neutrophils. Here it is non-degenerative, and typical egg fry appearance you can see in acantholytic cells in case of Pemphigus foliaceus. Even though you have in dermatomycosis, you can very well rule out by culture or any other method like other Woods lamp and other examination, even by taking a trichogram and direct microscopy, we can rule out all those things. So this is very easy to identify, and also you can treat, see the response by treatment, we'll have an idea about the disease.
Thank you, doctor.
Next.
So how to differentiate from hypothyroidism in dogs?
Hypothyroidism, we can very well see the history, everything. Hypothyroidism will not have these light of this pustules and crust and other thing. They will be having other symptoms like for the hypothyroidism. Hypothyroidism, you have obesity, you have the erectile appearance or myxedema, the dullness, it won't be active, alopecia in nasal region or neck region, and even the inguinal region, I mean, and the flank region. So those things will be very prominent, and it will be in the middle age, even though this also will be in the seen in any group, particularly in middle age. Hypothyroid, we can very well assess by seeing the T4, total T4 and TSH. So initially you can see the less than 1 is the total T4. If you have suspicion, then we can confirm with the TSH, which is going to get elevated. So those things will be very good indication along with the clinical signs.
Thank you, doctor. A few more questions are there. How long we should use the steroids for the treatment? Hello, doctor.
So we have to see we can very well combine with the azathioprine, and we can taper the dose. If it is going to have a very good response, we can taper and continue with the azathioprine or cyclosporine, whichever is responding well in our regular practice.
Okay, two more questions are there, doctor. Ma'am, you have said about the glucocorticoids affect the liver. So prednisone worsen the condition, or it's going to be helpful? And what will be the dosage?
In autoimmune disease condition, it's helpful.
We have to check the liver function also then and there. But generally, when you give any immunosuppressive like prednisolone, it will have elevation of ALT. That also should consider. We can check ALP also will get elevated when you use that. So you have to check other modalities also.
Okay. So one more question is there. So after vaccination, the dog was reported developed a canine pemphigus. So how long we use the steroids? That has been answered. What about boosters or next schedule of vaccination?
So we can go for the booster and everything, but the therapy must be continued until the remission of the clinical signs and everything. And we go with the histopathological examination once again to confirm whether the dog is having Pemphigus foliaceus or not.
Thank you, doctor. So if there are no further questions, we'll move on to the next section. Thank you, Dr. Jyothi, and thank you, Dr. Nagaraj, for answering the questions and the wonderful answers. So now to conclude today's program, we invite Dr. Nilesh to deliver the vote of thanks. Over to you, Dr. Nilesh.
Thank you, ma'am, for letting me giving vote of thanks. Thank you, our wonderful speaker. We have found a new speaker for IAVD, and it was very insightful and wonderful webinar today. And the queries were very good, and it was realistic. Also, thanks Dr. Nagarajan sir, President IAVD, and all others executives of IAVD, and team of Drools, who have been associated with us since last 2 years. So thank you all of you. Thanks a lot. We'll meet next month. Thank you.
Thank you, Dr. Nilesh. So now we'll move on to the close section. Before we wrap up, here is a gentle reminder to fill out the link I have shared in the comment box to receive your participation certificate. So thank you once again for joining us and contributing to success of today's webinar. And we look forward to welcome you to our future sessions. Have a wonderful evening. So that's the end of the section. Thank you, everyone.
You know, my friends and I, we talk about everything under the sun. So how can we leave out discussing something as important as our pets and their diets?
Always remember to check the back of the pack when it comes to buying food for your pets.
Make sure that you're feeding only real and clean ingredients.
It is 100% real chicken.
No byproducts
Or fillers.
All natural, all healthy ingredients.
It gives them the best of both, taste and nutrition.
Drools.
Drools. Drools.
Drools.
Drools.
Drools. Feed real.
Fitly.